Hello everyone, hope so all of you are fine and welcome to my channel. Today we will discuss about respiratory support. First of all, we will discuss about why we give respiratory support to the patients. First of all, if the patient's lungs have collapsed due to respiratory failure, then we will give patient respiratory support. Secondly, if the gaseous exchange is not occurring at molecular level or gaseous exchange is disturbed at molecular level, then we will give respiratory support to the patients. Third, there is a criteria. If the patient meets these two criteria, then we will give the patient's respiratory support. That criteria include if the partial pressure of oxygen is less than 8 kilopascals, then we will give respiratory support to the patient. And also if the partial pressure of carbon dioxide is more than 6 kilopascal, then we will give respiratory support to the patient. Now we will discuss about 5 respiratory support in detail, which I have told you in the previous lecture. So let's do a revise of that lecture so that you can better understand the concepts. That is the flow chart for the respiratory support. There were 6 types of respiratory support: oxygen therapy, conventional mechanical ventilation, continuous positive vapor pressure, also called CPAP. CPAP has further 2 types: continuous flow and demand flow. Fourth one is non-invasive mechanical ventilation and last one is positive and expiratory pressure, also called as PEEP. Conventional mechanical ventilation has further 6 types: continuous mechanical ventilation, intermittent mechanical ventilation, synchronized mechanical ventilation, inverse ratio mechanical ventilation, inspiratory pressure support mechanical ventilation, and respiratory support mechanical ventilation. This is the quick overview of the previous lecture so that you may better understand the concepts. Now we will start their details. First of all, we will discuss about oxygen therapy. In oxygen therapy, high concentration oxygen therapy is given by the process of diffusion, means in body the partial pressure of oxygen or level of oxygen is less and we are giving high concentration carbon dioxide from outside the body. Bag valve mask, also called as BVM, and laryngeal mask are used in oxygen therapy. Second one was conventional mechanical ventilation. Conventional mechanical ventilation control inspiration and expiration. In inspiration, normally air goes in our lungs. If due to any reason our inspiratory muscles are not performing well, then we will give them respiratory support and we will perform the function of inspiration or the function of inspiratory muscles mechanically or manually. For example, if we wanted to fill air in balloon, then what we will do? We will blow into the balloon and we will send continuous air into the balloon so that it may swell. And when the balloon will swell and now we wanted to remove that air out of the balloon, we will leave the balloon and all of the air will come out. Same is the case with conventional mechanical ventilation. In conventional mechanical ventilation, if we wanted to do inspiration, then we will give continuous positive air into the lungs, or we will send continuous positive air into the lungs. When we will send air into the lungs, then pressure will be built up into the lungs. Due to pressure build up, the lungs will inflate. Now the question is how much air we have to send into the lungs. To control the amount of air we are sending into the lungs, conventional mechanical ventilation has parameters which are set onto the conventional mechanical ventilation machine. Pressure, volume and time are 3 parameters that are set on every mechanical ventilation. Through these parameters we will control how much pressure of air we wanted to send into the lungs, how much volume of air we wanted to send into the lungs, and for how much time we wanted to send air into the lungs. And when that set time is finished, the lungs will automatically expirate. Now we will discuss about types of conventional mechanical ventilation, that is continuous mechanical ventilation, intermittent mechanical ventilation and synchronized mechanical ventilation. First of all, we will discuss about continuous mechanical ventilation. In continuous mechanical ventilation, we control both inspiration and expiration. It is comfortable for unconscious patients because unconscious patients are not taking their normal breath, and it is not comfortable for paralyzed patients or conscious patients because they are also taking their own breath. Now we will discuss about intermittent mechanical ventilation. Intermittent mechanical ventilation is slightly comfortable. Along with inflation and deflation, patient is also taking his normal breath. That's why it is slightly comfortable. Now we will discuss about synchronized mechanical ventilation. Synchronized mechanical ventilation, as its name is showing, it has the same procedure as of previous two, but the difference is that the patient's normal breath and the breaths coming from the ventilation are synchronized. Patient is also taking his normal breath and breath from ventilation are also coming, but both of these are synchronized. That's why it is most comfortable for the patient. Now we will discuss about third type of respiratory support, that is continuous positive airway pressure. As its name showing, continuous positive airway pressure is a device that gives or sends continuous positive airway pressure into the lungs or airways. It treats hypoxia, but it doesn't treat hypercarbia, means it has no role in removing carbon dioxide from the body. Now we will discuss about its two types. It is continuous positive airway pressure is also called as CPAP. CPAP has further two types, continuous flow and demand flow. In continuous flow, as its name is showing, the continuous air goes into the lungs whether the patient has need or no need. It is old method. Continuous air goes into the lungs, but it has two drawbacks, including it has more noise and it is more uncomfortable for the patient. Now we will discuss about demand flow. Demand flow is the modification of continuous flow. As its name showing, it gives only oxygen to the patient only on demand. According to demand of patient, positive airway pressure goes in the body. If the patient has no demand, patient has no need, the air will never goes into the lungs. Only on demand, only on need, the air will goes into the lungs. Continuous positive airway pressure will goes into the lungs. It is modification of continuous flow, as I have already told you, but it does not assist work of breathing. Next type is PEEP. PEEP is CPAP combined with mechanical ventilation, means in CPAP I have told you they will never assist work of breathing, but in PEEP it will assist work of breathing. Now we will discuss about indications of respiratory support. Indications of respiratory support include adult distress respiratory syndrome, because in adult distress respiratory syndrome gaseous exchange is not occurring. Pneumonia, asthma, chronic obstructive pulmonary disease, respiratory muscle weakness, chest trauma, pulmonary edema, and elective post-operative ventilation, means it assists during surgery because of anesthesia. Now this criteria I have already told you in the start of the lecture, that if the partial pressure of oxygen is more than 8 kilopascals and if partial pressure of carbon dioxide is less than 6 kilopascals, then these are the two conditions to give respiratory support to the patients.